So thank you very much. We are Innovation for inviting me to this very interesting meeting. Let's see what I can contribute here. First, no, this was the other way around. So first, my disclosure. I have been consulting for most, if not all, pharmaceutical companies developing smoking cessation treatments. And I was also involved in the development of the first nicotine replacement products in Sweden during the 70s. More recently, I have also consulted for tobacco companies with an interest in development of less harmful products. So, does nicotine cause cancer? That's of course a divider, whether we can like this or not. The WHO say no. Nicotine is common chemical compound found in tobacco plants, and its effect is to make tobacco addictive rather than to cause cancer directly. And also nicotine is on the list of essential medicines for the WHO. And what about the other side of the Atlantic? In Washington, this was a quote when they approved the first nicotine pouch in the US. Nicotine is what keeps people using tobacco products. However, it's the thousands of chemicals contained in tobacco and tobacco smoke that makes tobacco use so deadly. Some of these chemicals known to cause lung damage are also found in some e-cigarette aerosols. This toxic mix of chemicals, not nicotine, cause the serious health effects among tobacco products. So if these authorities are right, it's a little difficult to understand. For example, the old Swedish snus that was the first product, even a risk reduction license in the US, was banned in the European Union. And now we have the similar case with nicotine pouches, where there seems to be an interest in the European Union to ban it, while in the US they seem to embrace it. So, if nicotine by itself is not that harmful, it seems that tobacco is ideal for harm reduction. With alcohol we can't do that, because alcohol, that's what the user wants, but that's also the substance that is causing not only the dependence, but also the harm in the liver and cardiovascular system. So pure nicotine and even unburned tobacco is not the primary cause of tobacco-related morbidity and mortality. So here are some Swedish invention. Snus is a very old thing that existed for at least 200 years. We have the nicotine replacement products that were conceived and developed in Sweden from the very beginning of the 70s, and I was part of that development. And the more recent one is the nicotine pouches, which is actually a cleaning up of the old snus that contained some tobacco-specific nitrosamines, for example, that at least theoretically could cause and promote cancer. So the cleaning up, it's interesting to look at the content of these pouches here and the nicotine replacement over there. The ingredients are relatively similar. They buy the nicotine from the same company. The nicotine is carried by microcrystalline cellulose, except in the gum, for example. It has to be a gum base, otherwise it isn't a gum. Then there are sweeteners, which are very much the same. And there is substances that controls the pH, usually increasing the pH, which are also very much the same. Where there differs, there is flavorings. There are usually more alternative flavors with the nicotine pouch products, and also the nicotine level might be higher in the nicotine pouch products. But otherwise are the ingredients similar, if not identical. So then you also would think that the health and the adverse effects would likely be similar. And this is a study where they have looked at all harmful and potentially harmful constituents in a number of nicotine products. You find more of course in the cigarette, you find much less in the snus, and even lesser in the nicotine replacement product and nicotine pouch products. And here is another similar study where they have looked at a lot of potential toxicants and potential carcinogens. And here there is NRT products, 4 milligram gum, and there is nicotine pouches. And I'm not going into any detail here, they are similar. You can detect very low levels in both product categories, and some are higher with one particular component and another one with another. So it's nothing to be concerned with. Here is a study that I looked at the relative harmfulness of a number of nicotine products again. And of course the combustible cigarettes are ranking very high in other combustion products. As we get down to smokeless products, we also go down in relative harm, and when we get to snus and no nicotine at all and nicotine pouches, we are talking about very, very minor levels. And funny enough, as I mentioned, we tried to ban these products in Sweden. In the US, the Secretary of Health said that nicotine pouches are the safest way to consume nicotine. And nicotine itself does not cause cancer. There is no evidence that it's cancerogenic. It's adding that the things we really want to get away from, that's cigarettes. And cigarettes should not be given a monopoly for people who like to use nicotine. It's not only Sweden which are using alternative products, carrots, if you would like, not just the carrots. In Norway we see snus has increased and smoking has decreased. In the UK we can see that vapes have increased, cigarette smoking decreased. In Japan we can see after the introduction of heat not burn products, they have increased, cigarette smoking has decreased, and finally in New Zealand it's vapes again increased and cigarette smoking decreased. So it's not only Sweden and Greece. So Sweden has reached the 5%, but EU targets to reach the 5% at 2040. And as we already have heard, the global burden of disease, they project that there will be 19% smokers in the EU at 2050. So obviously the European Union needs something new, something different to get the smoking down. Sweden is at 5%. The last government has been a very good government for harm minimization in Sweden. To further accelerate the downturn, the government actually reduced the tax on snus by 20% and increased it on cigarettes. Again, to give it a positive revenue for the one that would switch from cigarettes to snus. It would not only be less harmful, it would also be economically a good idea. And the Secretary of Health is endorsing the perspective. Busy picture, but this is tobacco attributable deaths among males in the European Union. And this is what we are all fighting, the tobacco attributable deaths. There are 3 countries among the EU, actually Norway and Iceland are not part of the EU, but anyway. There are 3 countries on this picture that has turned to using alternative products. And it so happens that these 3 come in one end. You have the lowest tobacco attributable mortality. If the placement of these 3, Iceland, Norway and Sweden, would be random, it would happen in 1 out of 20,000. So the statistical significance here is huge. And it suggests that it's probably because they are using, to a larger extent than elsewhere, less harmful products than cigarettes. So smoking prevalence can be reduced with alternative products. We have seen a couple of countries. For Sweden, we have convincing data of reduced harm. I haven't actually shown that, but we have plenty of that, and that's why FDA also gave Swedish snus the first license as a less harmful tobacco product. And this can happen without demanding government subsidies and costs. Nicotine pouches are likely to be the safest consumer product. Let me go back and what I might add here as a conclusion, that is, if we are introducing and broadly introducing the less harmful products, if the target is to fight dependence, that would not be a very good solution. People would be dependent but on another thing. But if the target is to reduce the suffering, the disease and the death, it's a very good solution. Then we will be left with the dependence, as we are with caffeine, and I would suggest that if the society couldn't accept the dependence to nicotine as we do to caffeine, it would be easier to get rid of the alternative products that we have than the cigarettes, because the cigarettes is the most dependence-producing administration form that we know. Thank you.